Hi, I'm good. How are you?
All right, I'm John Singleton. I'm gonna be your interviewer today, and I see you're applying for our CNA position here.
Yeah.
And before we get started, I'm gonna run down to you everything that CNAs do here.
All right.
It can be a little disgusting,
Okay.
if you will. And during the interview, we're gonna go through a series of questions I'm gonna ask you, and during that, if I tend to not look at you, I'm not listening.
Okay.
I'm just getting my final evaluation for the end.
Okay.
Okay. Sound good?
Yeah.
All right. A CNA here, you're gonna go through basically hygiene. You're gonna give baths, toileting, change briefs,
Okay.
and feeding.
Yeah.
And have you done all that at your previous job?
Yeah. Done all that.
Okay. And so now you can just tell me something about yourself.
My name is Charles Singleton. I've been a CNA for 3 years, and I got my certification at Kent Careers Technical Center. I'm a student at Western Michigan University. I've been there for 2 years now, and looking for a full-time position at your company.
Okay. So you say you go to Western?
Yep.
What is your major?
Health administration.
Health administration. So in the next 5 years, where do you see yourself in the next 5
In
years?
the next 5 years, I see myself with hopefully a foot in the door where I could probably pursue a career here with my major.
Okay. Because my major at Western was health administration also.
Oh, okay.
Yeah. Yeah. So why did you decide to take up CNA profession?
I decided to take up CNA profession because I want to make the difference. I've heard a lot of stories about how people don't really get the correct cares, and I want to be the change and just help out as much as I can and treat elderly how they should be treated, with respect, and even though they lack some qualifications.
Okay. With that being said, how do you deal with respecting patients? How do you deal with patients when they're agitated? How would you go about that?
I would try to redirect them, and if I can't redirect them to make the situation easier, I would just tell the charge nurse and let her or him decide where to go from there.
Okay. For example, if you've seen a patient with high dementia and he was combative and wandering, what would you do to resolve that situation?
I would probably provide one-on-one care for that resident. I would probably be with that patient while they're wandering if I'm not gonna make him or her do anything that they don't want to do, being that they're combative. But I'll try to redirect them until a certain point to where they're not combative at that time. But until that time is, just stand by them and try to be patient.
Okay. During shift changes, what do you do to make a smooth shift transition?
When I first get there, I go through rounds with the other aides from the previous shift, and they basically tell me what went on, what was done earlier, what personalities came out, what personalities didn't, who went to the bathroom, who didn't, things like that, and they just let me know, or I let them know everything that happened previously, so everything can go smoothly for the next shift.
Right. All right. Tell me about a time when it's the end of the shift. You finish all your work, but you have 30 minutes left. What would you do? What do you do to pass the time by?
To pass the time by, I chart. I chart on residents and make sure all that's done to have for the nurses, because I'm pretty sure they need all that to report back to use for their report. So I would probably be charting from how the day went.
Okay. What is your greatest strength?
My greatest strength is being a team player. I have the ability to work with others pretty well, and I'm not. I don't really use the term groups, because it's not really a group. It's a team effort, and if anyone needs help, I'm there to help. And
okay. And that is good, because here teamwork is how we give the best quality of care, and to ensure that families are comfortable and they know that feel safe with us providing for their loved ones. Okay. What is your greatest weakness?
My greatest weakness is that I care too much. Usually we probably have a death or two, and that can be hard. Building the relationships you have with the residents, but you have to overcome that and keep it professional and understand that people are gonna come and go.
Right. What would you do if you seen one of your coworkers or anybody being abusive towards a resident?
Well, the most I can do is stop it at that moment, but going on, I would probably report it to a higher management.
Okay. Share with me, my last question, share with me an example when you went above and beyond, above what your supervisor asked of you.
A time I went above and beyond is when we were short on a hall, and I had to work. I usually work with 8 residents, but because we were short and didn't have a full staff at the time, I had to care for 16 instead of 8. So that's the time I went above and beyond. I had to buckle down and get business done and care for 16 residents when I'm usually used to 8.
All right. Well, Charles, it was nice meeting you, and I'm gonna review I'm gonna do my final evaluation.
All right.
And I'm gonna get back to you in a week. Is there any more questions that you have that you want to ask me?
No.
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 All right. Well, it was nice meeting you.
Maybe.